this is a patient that I did. So the top picture is a picture of her teeth post clear aligner therapy. So she, obviously, I always tell my patients, hey, listen, when we align your teeth, you're going to see a lot of changes thereafter, and you're going to notice chips and different shapes and so forth. And so it's going to bother you. So at the end, we're either going to choose ceramics or we're going to choose composite bonding artistry. And this patient chose to do bonding. So you can see that middle picture, that's the starburst bevel with various depths. And what that does is that it just creates a nice transition between the composite and the tooth structure. So you don't get that ledge or that weird finish. It just blends in real nicely. And the blue line is showing that I etch beyond the bevel. And the yellow line is where I bond. So just right below the etchant is where I'm going to place the bonding agent, air dry, and then cure. And you can see the bottom picture is the final result. I believe on this patient, I used 2 layers or 2 different shades of composite and 2 tints, a little bit of white and just a little bit of gray along the incisal edges. But again, you have to control it so you don't put too much tint or too little tint. Whenever I'm doing anterior composites, the first thing I do is I'm going to select my shade prior to dehydration with a rubber dam. So there's numerous ways you can do it. That picture on the lower right is the smile light. So it's a nice little, it looks like a little wand with the polarized filter. And so I'll choose different shades. And so obviously with experience, you're kind of going to know which shades to go with. So I'll pick different shades and I'll put little dots. And what I'll do is I put these dots on the tooth surface that I'm going to be bonding. And I'll use that and I'll cure them. And these dots, when I tell you how they are, it's almost like a teardrop. It's going to be a little thick at the top and then it'll smudge down to thinness on the bottom. That way, it's not too thick and it's not too thin, and you're not getting misconstrued with, oh, wait, this shade looked good before, but really it was a little too thick or it was a little too thin. And so I'll cure it, and then I use this smile light to look at it through the filter and say, okay, which shade do I like? Which one's going to work? What layers am I going to use? These are my instruments on the left that I use when I'm doing any sort of bonding technique. And some of these instruments are by Cosmedent, by Clinician's Choice. I use them all, and Ivoclar. And it just depends what surface I'm doing, what area I want to manipulate. So I always feel like it's like a toolbox. This is my toolbox, and we pack all these instruments together, and my assistant has them laid out for me. So I just pick what I want. Now, in terms of discs, so whenever I'm contouring the teeth, I've really learned to love disking. And, this is an array of my discs, and some of these are by Meisinger, by Clinician's Choice, by Cosmedent. I'll use any type of disc as long as I can get the contour correct. And I'm a big line angle person, so my line angles have to be perfect. And so that's how I get my line angles to be good, is with these discs. So I'll start off with the blue or the white one or the blue, and then move on to my polishing ones. So it just depends, going from heavy to extra fine. I always mark up my line angles. So you can see that I've marked up the mesial-distal line angle, the incisal-facial planes, and the lingual. That way I make sure that everything is congruent and we're getting the shapes that we want on the teeth. So my checklist is, okay, let's first start with polishing and contouring the length. So I'll use one of the discs. So I'll start with the heavier grit disc, and I'll go ahead and fix the length if I need to. Then I go ahead and go onto the incisal-facial line angle, smooth that out. And I'm going to use the adjacent teeth as my marker. So that way, if I need to have some sort of reference point, I know which way to go, or the contralateral tooth. Facial plane, always smoothing out the disc. And at this point, if you're using a grittier disc, then it's going to start to dull. So it's perfect for your facial plane. Again, you don't want to overlayer because you don't want to cut back and remove all of that beautiful artwork that you just did. So just layer accordingly. And by the time your disc gets a little bit dull, it's just going to create a nice little finish. Proximal line angles. I can't tell you how much time I spend on line angles. I will spend a lot of times until they're perfect. And so what I do is I'll mark it, go back and fix it with discs, mark it again, and I'll just repeat this pattern until I see the perfect line angle matching the adjacent tooth.